I got rushed down to John Hunter Hospital and they saw a lesion on my brain with a CT scan. Well, Saturday afternoon I think they'd done the MRI, and then by the Sunday they were cutting me open. Lab results came back to tell me that it was a malignant tumour, and my mum was with me at the time. I was on speakerphone and mum just sort of, it's hard to talk about it, but she just sort of started trembling and she's like, oh no, my son. She just broke down in tears. Not sure if it was before surgery or after, but I just remember Sandy, the care coordinator, brain care coordinator in John Hunter, came in and saw me. And just her presence, firstly, was just so calming. Like, you just felt comfortable to ask her questions. You didn't feel silly or intimidated by, doctors. And if Mark Hughes Foundation can get one of those ladies or men in this area, what it would do for the families would just, be incredible. It'd just take a whole heap of stress away from people, and just, you can have your family around you. You don't have to travel. You can't put a word to that it would just be amazing.
I came to nursing a little bit later in life, and I've been nursing for about 8 years now. What brought me to oncology was when we were younger, we had a young family, my husband and I, and he was diagnosed with leukemia. Being in the oncology ward when he was having treatment, I just looked at the nurses and just how rewarding and how beautiful and loving they were to their patients. And it looked really fulfilling and something that I just thought that's what I'd really like to do. I love it, it is rewarding, and it's nice to see people come in and get good quality care. It's the one-on-one, it's the personal aspect, it's getting to know the patient, the family, their carers, and just making sure that they have quality in their life.
I've been a registered nurse for the last 17 years. The last 7 have been in Tamworth at the Cancer Centre, and prior to that I was a medical palliative care nurse at Port Macquarie Hospital. What I like about the job is being there to help the patients, help them through this very difficult journey. It's so devastating, any cancer diagnosis, but especially brain cancer. It affects all aspects of life, not just physical but mental as well. We have wonderful coordinators in Tamworth who cover all tumour areas, but brain cancer is so specified and so many different aspects need to be looked at, services in place and care for not only the patients and the families. So be able to provide that to the patients is something I'm really looking forward to.
The amount of times I'm told stories of the amazing work that our brain cancer care nurses do fills my heart with pride. All these people that buy beanies, do fundraisers, our volunteers, our team, all this hard work we're doing, it really does mean something. Patients and their families are going to benefit big time in what potentially is the toughest time of their life. It certainly makes the Mark Hughes Foundation feel very proud.